Namaskar, welcome to PKS classes. Today we are going to discuss about the beta-lactamase inhibitors. So before discussing about that, let us discuss what is this beta-lactam. So this is the structure of the beta-lactam ring, and the beta-lactam ring is essential for the antibacterial activity of beta-lactam antibiotics, and this beta-lactam ring, you can see, can be degraded by the enzyme beta-lactamase, and this beta-lactamase is produced by bacteria. And this beta-lactamase, when breaks this beta-lactam ring here, so there will be hydrolysis, H and OH are added here. So this bond is broken, and because of which there is no antibacterial activity, because this ring is essential for binding with the transpeptidase enzyme, which is required in the final step of the peptidoglycan biosynthesis, and peptidoglycan is the essential constituent of bacterial cell wall. So the beta-lactamase is produced by bacteria, the gram-negative bacteria like Enterobacteriaceae, Pseudomonas aeruginosa, Haemophilus influenza, Neisseria gonorrhoeae, the acid-fast bacteria like Mycobacterium tuberculosis, and the gram-positive bacteria like Staphylococcus aureus. Among these, we call these Enterobacteriaceae and Pseudomonas aeruginosa as extended spectrum beta-lactamase producing bacteria. So there are four main classes of beta-lactam antibiotics. You can see this beta-lactam ring present in penicillin, cephalosporin, carbapenem, monobactam. These four class of beta-lactam antibiotics: 1 penicillin, 2 cephalosporin, 3 carbapenem, 4 monobactam. And beta-lactamase breaks this beta-lactam ring here, and because of this there is formation of the inactive metabolites, so there will be no antibacterial activity. Not only with penicillin, with cephalosporins, with carbapenems, with monobactams, everywhere beta-lactamase can break. So these are the carbapenems. You can see few carbapenems like biapenem, pharopenem, ertapenem, meropenem, doripenem, imipenem. So the beta-lactam ring here, beta-lactamase enzyme breaks here. Similarly, let us see some monobactams like aztreonam and the trigemonam, taptoxin, nocardisin A. So everywhere the beta-lactam ring is there, and this beta-lactam ring is broken by the beta-lactamase enzyme. Okay, and this loses the activity. So beta-lactam antibiotics, the mechanism of action, if you see, there is 3-4 cross-linking. You can see here NAM is N-acetyl muramic acid, and there is a chain of amino acids to third amino acid of one NAM, the fourth amino acid of another NAM is cross-linked, and this cross-linking is done by the enzyme transpeptidase, and beta-lactams bind to this transpeptidase active site and inhibits this cross-linking, so because of which they inhibit the bacterial cell wall synthesis by inhibiting the bacterial peptidoglycan synthesis. So bacterial cell wall synthesis is inhibited, and for this the target is this enzyme transpeptidase. And this transpeptidase is also called as penicillin binding protein PBP, because penicillin is the first beta-lactam antibiotic, and accordingly this target is known as penicillin binding protein. So you can see here also 3, 4, 3, 4, 1, 2, 3, 3 and 4 with N-acetyl muramic acid, 1, 2, 3, 4, 3, 4, 3, 4 cross linking. So here again 3, 2, 4, 3, 4, 3, 4 cross linking. And when the beta-lactamase breaks the beta-lactam ring, when the beta-lactam ring is broken, as we have already discussed, when this beta-lactam ring is broken by the beta-lactamase, so this will be broken, means this will be like this, COOH, and then it is NH, and the rest part will be there. So this becomes inactive because this bond is broken in the beta-lactam ring, and there will be no binding of the beta-lactam ring with the transpeptidase enzyme, so there will be no action. So we can say that because of beta-lactamase, this cross-linking, the peptide cross-linking, the transpeptidation process is inhibited. So we can use the beta-lactamase inhibitors. We call them as the suicidal inhibitors because they irreversibly inactivate the beta-lactamase enzyme. Please see our previous class on suicidal inhibitors. So these beta-lactamase inhibitors are used in combination with beta-lactam antibiotics to potentiate their actions. And let us classify the beta-lactamase inhibitors. Beta-lactamase inhibitors with beta-lactam core. So these beta-lactamase inhibitors also have the beta-lactam ring, and we call them as suicidal inhibitors because they permanently or irreversibly inactivate beta-lactamase through secondary chemical reactions in the active site. And they can be either natural or the sulfone derivatives, penicillinic acid sulfone derivatives. Natural because they are produced from Streptomyces bacteria. So clavulanic acid is produced from Streptomyces clavuligerus, and olivanic acid is produced from Streptomyces olivaceus. Penicillinic acid sulfone derivatives like sulbactam, tazobactam, N-met-tazobactam. So these are some of the examples. Then there are second group of beta-lactamase inhibitors, which we call them as non-suicidal inhibitors, because they bind to the beta-lactamase enzyme with high affinity and form sterically unfavorable interactions. So there is no irreversible inhibition, and these drugs are without the beta-lactam core. So in their structure there is no beta-lactam core, and they can be classified as aza-bicycloalkanes and cyclic boronic acid derivatives. Aza-bicycloalkanes like avibactam, relibactam, durlobactam, zidebactam, nacubactam, and cyclic boronic acid derivatives like vaborbactam, taniborbactam. So this is the beta-lactam ring and present in penicillins, carbapenems, cephalosporins, and the monobactams. And when we discuss the beta-lactamase inhibitors, the beta-lactamase inhibitors with beta-lactam core like clavulanic acid, sulbactam, N-met-tazobactam. So everywhere you see this beta-lactam ring is there. But you see the beta-lactamase inhibitors without beta-lactam core, we can call them as non-beta-lactamase inhibitors. You can see this bicyclo, this cycle 1 and this is the cycle 2, bicycloalkanes, aza-bicycloalkanes and the boronic acid derivatives. So vaborbactam, avibactam. Let us take some more structures. So you can see, as per the classification, aza bicycloalkanes and cyclic boronic acid derivatives. So you can see this is bicyclo, first cycle, second cycle, aza bicycloalkanes. This is also avibactam, relibactam, then you say durlobactam, then zidebactam, nacubactam, all are aza bicycloalkanes, and vaborbactam, taniborbactam, these are the boronic acid derivatives. Okay. So we use this combination, the beta-lactamase inhibitors with the beta-lactam antibiotics. So amoxicillin is the beta-lactam antibiotic, clavulanic acid is the beta-lactamase inhibitor. So clavulanic acid on its own has no action, no antibacterial action, so 0. Amoxicillin is the antibiotic with antibacterial action, so 1. So when we combine them, 1 plus 0 is greater than 1. So this is an example of potentiation. So some more examples like cefuroxime plus clavulanic acid, cefixime plus clavulanic acid, ampicillin plus sulbactam, cefepime plus tazobactam, ceftolozane plus tazobactam, ceftazidime plus avibactam, piperacillin plus tazobactam. This is most commonly used combination nowadays. Then imipenem, because it is degraded by dehydropeptidase, so one dehydropeptidase inhibitor silastine can be used. Then the beta-lactamase inhibitor relibactam. So imipenem plus silastine plus relibactam, meropenem plus vaborbactam. So these are some of the examples of beta-lactamase inhibitors combined with the beta-lactam antibiotics. So this is all about the beta-lactamase inhibitors. Thank you.